At each of these booths, people can legally inject themselves with drugs.
I've never stopped. I've been a junkie since I was 12 years old.
This is Insight, the first supervised injection facility in North America, located in a Vancouver neighborhood hard hit by the opioid crisis. Funded by Canadian taxpayers, addicts bring their own drugs in and shoot up under the supervision of a nurse.
Inside, I have overdosed once. Outside, I have overdosed about 8 times.
Since opening in 2003, 3.6 million people have used the facility. 6,400 of them overdosed, but no one has died.
It really is just trying to take some of the politics out of it and really looking at it through the lens of someone who is ill and needs treatment.
Insight operates under a health exemption from Canadian federal law. The idea to reduce deaths, the spread of disease, and overdoses on the streets, as well as refer people to treatment services.
We've really taken a science-based approach, so looking at addiction from a health perspective, it's no different than any other diseases. If someone has cancer, they can go to a cancer clinic.
Several U.S. cities, including Philadelphia, San Francisco, and Seattle, are seriously considering opening similar facilities. Massachusetts officials plan to visit Vancouver. They appear skeptical of the idea. But what about New Hampshire?
The safe injection site is not on our plate at this time.
Manchester Public Health Director Tim Soucy says Narcan and the needle exchange program are saving lives. But he says a needle injection site is not the answer.
When you talk about harm reduction, it's really at the end of the spectrum. I mean, a community really has to be ready to embrace that type of a system, and it needs to be a community dialogue, and Manchester's just not ready for that.
Mike Cronin, WMUR News 9.